Ryan, we get into an interesting argument with adult critically ill patients, and that is if your clinical suspicion is that there are issues here that are going to compromise bowel function, do you start a standard formula and just wait to see if intolerance develops? Why wouldn't, if your suspicion is high, start with a small peptide formula that you know is going to give you your best shot?
Right. I agree with you completely. And in fact, in pediatrics, what most of us do is you choose the formula based on what your patient has and what your patient needs. And if your patient has a condition where you know they will not be able to tolerate a complete intact lactose or a complete intact protein, we do start with a peptide-based formula, which is also lactose-free, which gives them their best chance of tolerating the formula. If we find that, they are doing okay with that, then we kind of advance feeds and go from there. And then there are other issues which come about as to if then you're going to transition them from enteral feeds to oral feeds. There are palatability issues which come on, and then we address those issues. So, to address the point, in patients who we think have some kind of gut dysfunction, primarily related to mucosal lining and not necessarily just motility, then we do oftentimes start with the peptide-based formula.
Sure. Another interesting argument we get into, I can't tell you how many prospective randomized trials I've been involved with where we are going to have to pick a study formula for a large population of critically ill patients. And the comment comes up, what formula could we pick that would be tolerated by the greatest number of patients? And invariably, we end up selecting a small peptide MCT on formula.
And I guess that brings up the point of why are you storing them on formula? And a lot of times in children, we are storing them on formulas just to boost calories. These are children who are a little bit selective and are not taking in enough calories. And in those kids, we don't necessarily start with the peptide-based formulas because we do believe they have an intact gut. And we are giving them formulas primarily as calorie supplements and calorie boosters. And that's when we use formulas which are high in calories but do have an intact protein. However, in children who we're storing the formula because we believe there's some kind of gut dysfunction where it's not working right or mucosal damage, that's a patient population we start with peptide formula.